Hello, everyone. Welcome to the forum at Harvard School of Public Health. I'm Abigail Trafford. I'm a journalist, and I'm your moderator. Today, we're going to talk about what is called toxic stress response. It's the impact of severe hardship on brain development and also the development of diseases later on in life. We're also going to explore ways to identify toxic stress and ways to build up resilience to it. We have a great panel. First of all, we have Jack Schenkoff. He is Director, Center on the Developing Child at Harvard University, and he'll discuss the new scientific evidence for toxic stress and the implications for children and their parents. We have Bob Block. Bob is President of the American Academy of Pediatrics, and he will explore the expanded role of pediatricians in addressing toxic stress. And Roberto Rodriguez, you come to us from the White House on screen. You are the Special Assistant to the President for Education Policy, and you will talk about how do you translate this new science into public policies. Now, each expert is going to talk for about 4 minutes. Then I get to ask terrible questions of them. And then we open it up to questions for you in the audience and online. So let's start with you, Jack.
Great. Well, first, thank you to the Harvard School of Public Health for this opportunity. I think it's not insignificant that the American Academy of Pediatrics, the White House, and the scientific community are coming together to talk about new science to address old problems. So the issue here is, what do we know from advances in neuroscience, molecular biology, the behavioral and developmental sciences, and this revolution in genomics, about the roots of problems that basically plague our society and societies around the world, problems of intractable poverty, maltreatment, discrimination, all of which lead to greater likelihood for problems in health, problems in learning, problems in behavior. And what's exciting about this opportunity is we're at a tipping point in the development of this biological revolution we're living through in science, where we now are beginning to understand in a way we never did before of how early experience literally gets into the body and affects the development of the brain, affects the development of the cardiovascular system, the immune system, metabolic systems, and provides new insights, new opportunities to ask the question of what is it about hardship that leads to more illness, that leads to more problems in learning, more problems in decreased economic productivity and a shorter lifespan. So what I'd like to do to start is to just define toxic stress, because it's often misunderstood. And the first thing for people to understand is that stress is a normal part of life. So we're not talking about the need to eliminate stress in people's lives. And in children's lives, learning to deal with normative stress is part of healthy development. But there are some causes of stress that are much more severe than just the first day in a child care center or getting a shot at the doctor's office, that can actually threaten the body. And what we call toxic stress is when our stress response systems are activated and stay activated for prolonged periods of time. When we're stressed, what we're feeling, everyone knows what it feels like to be stressed. What you're feeling is your heart rate is up, your blood pressure is up, your stress hormone levels are activated, your immune system is activated, your blood sugar is up, and that's good for you because it helps you deal with an acute threat. But when those stress systems stay activated for prolonged periods of times, weeks, months, when it's basically what life is usually like for you, this has a wear and tear effect on the body. It literally disrupts brain circuits as they're developing. It literally accelerates atherosclerosis. It produces insulin resistance, which can cause diabetes. And this is the way that we're beginning to understand how adversity gets into the body. And the exciting part about this is that this gives us some new ideas about how we might respond and protect children much more than we do now. So the key issue about toxic stress is not the cause of the stress. It's the fact that there aren't consistent, protective, reliable, supportive adult relationships to help children get through and learn to deal with adversity. So this is the stress we see in cases of chronic neglect, recurrent abuse, kind of the unremitting stresses of deep poverty where a family from day to day can't even put food on the table. This is not the stress associated with a bad day. It's not the stress associated with, gee, I had a really tough week at work. This is the stress associated with chronic activation of systems that are wearing the body down without reliable adult protection for children who are very much at risk. And I know we'll get into discussing this a lot more, but what's most exciting, and to thank the American Academy of Pediatrics and the White House to be part of a discussion, is this is new science that gives us new ways of thinking about dealing with some of the hardest problems we have to deal with as a society: school failure, economic dependence, and lifelong health problems that cost a lot of money and also impose a real psychic burden on all of us. So delighted to be here to talk about this.
Thank you, Jack. Let me turn it over to you, Bob.
Thank you, and thank you for the opportunity to be here and to represent the American Academy of Pediatrics, which as an organization represents 62,000 members. We're very proud of the fact that on our national agenda for children, we have two very important planks. One is the study and the science of early brain and child development, and the other is a relatively new science called epigenetics that we're trying to understand better and to try and see how that plays into the things that we'll be talking about today. We have a phrase that's been sort of my watchword, if you will, for my year as president with the Academy, and it goes very simply like this. Unfortunately, not every child will become an adult, but it is certainly true that every adult once was a child. Seems rather simplistic, but we as a profession, we as a nation have not probably paid attention to that simple phrase often enough. And we're just absolutely delighted to be able to publish and sponsor the technical report and the policy statement from the Academy, which directs the emphasis of the Academy's work toward the work of Jack and his colleagues. And thank you so much for your role in getting those papers to us. The thing that has struck me over my many years in pediatric practice, all the way from when I started training, if you count back to medical school, it's almost 50 years ago. There are so many things that are different now. For example, we used to deal with severe infections that are all now preventable by immunization. So we don't have children with meningitis. We don't have children with whooping cough. We don't have children with measles. We don't have children with polio. And we don't have them because we've invested our science efforts, our research efforts, our financial efforts, our development efforts into things like immunizations to prevent those diseases. Early in my career, we worried about children with cancer, various leukemias and other cancers who had less than a 10% chance of survival. Now it's exactly the opposite, and they have more than a 90% chance of survival because we invested research, we invested some money, we invested time, we were willing to look at how to establish what worked and what didn't work as we went through that process. We now can save children who come to our intensive care units with severe trauma or severe and unusual disease complications, again because we have new technologies, we have new medications, we have new approaches to treatment, we have new surgeries to do, because over the last 50 years we've paid attention to that. Now is the time for us to take advantage of the fact that we have new science that we haven't had in the past or haven't been as aware of in the past that really connects the reaction within children's bodies, their brains and their bodies, to toxic stress, to adversities, to disparities in the healthcare system, which we don't like to admit but are bountiful and unnecessary. And I think we have an opportunity now to make some changes. We have a healthcare system in this country that is not salvageable. It is not sustainable. It doesn't matter what your political ideas are, your philosophies are. We can't keep spending money the way we're spending it. We have more of our gross national product is going to healthcare than any other developed country in the world, and yet we have some of the worst results. And I think that one of the reasons we have that is now being demonstrated by looking at the science of the effects on children, of the environment that they're in. Jack and his colleagues termed eco-biodevelopmental approach to what's going on. If we can do that, we can shift where we spend our money, and we can do prevention. And rather than spending all of our money on things that could have been prevented, we're very good at fixing those things, but rather than spending the money there, why not spend it at the early part of life. And that's what pediatrics is all about. And we're delighted to be part of this forum and part of the solution that's going to develop, we hope, over the next several years.
Great, Roberto. But I think now is a great segue to you, Roberto. We want the solutions. Tell us how new research translates into public policy.
Good. Well, thank you, Abigail. And it's a real pleasure to join you all virtually here from the White House. I'm sorry I can't be there in person. We hosted the third annual White House Science Fair earlier today. So I'm here with young people from around the country who are going to be our next generation of scientists. Hopefully that'll help move this forward. I'm delighted to be part of the conversation. I want to applaud the Academy for this new statement on early childhood adversity and toxic stress. We clearly, at the federal level, are really appreciating the imperative, now more than ever, to shift our policies from ones that look at interventions later in children's life toward more of a policy arc that focuses on prevention and on early intervention. Approaching this from an education perspective, we know that these early years of a child's life matter greatly. The quality of adult-child interaction and relationships that they develop with adults early in life matter greatly. And the quality of the settings in which they spend time certainly matter. So we are really focused on doing a better job in these early years, even prior to a child reaching kindergarten, to make sure that regardless of where children are spending time, they are spending time in environments that are supporting their development, supporting their growth, and helping them really prepare for success later in life and later in school. We know that their development in particular, and I think today's work and conversation around toxic stress is a very important one, because we can't just focus on the cognitive development of these children, on early literacy and on numeracy. Those other elements are clearly important, but we have to be sure that we're doing more to meet the social and emotional needs of children, and doing more to really identify early the impacts of toxic stress, and do more to be able to provide the support and the early interventions that kids need to be able to remediate any of those challenges. And the sooner we can do that, the better. So we're focusing on an ambitious agenda around that here. It begins with funding that we've made available through the Affordable Care Act to provide more home visits for more of our needy infants and toddlers, make sure that we're connecting them to a full range of services, including health care, early intervention, early education services. We're providing opportunities for them to see mental health professionals, to see social workers, to see others that can help facilitate a positive arc of social and emotional development early. We're focusing on how we can transform our child care programs. Here at the federal level, we have over 1.6 million young children in those programs, so that those settings are of the highest quality, and they really can make sure that our children that are screened early and identified as being exposed to toxic stress can be referred to professionals into early intervention in a seamless way. We're doing more to really refocus our Head Start program on that comprehensive level of care for our youngest children. And Head Start has a history of really providing a strong social and emotional foundation along with the family service and support that's needed for our youngest children to succeed. And I think the most important thing that we're doing is we're looking at how we can bring together our Department of Education and our Department of Health and Human Services and model some of the behavior here at the federal level that we hope to see in the states and at the local community, where we have professionals from various perspectives coming together, all in the interest of making sure that our kids are getting what they need in the earliest years of life. So we've launched this Race to the Top Early Learning Challenge. And I can talk more about that during the Q&A here, but we have 9 states that are coming together around some real critical indicators around providing greater screening for more of our infant and toddler population earlier, making sure that we're focused on a high quality standard for our early learning programs, regardless of whether children are spending time in a preschool program or in an IDEA program or in a child care or Head Start program, to be sure that there's a high standard of quality and a high standard of intervention for those children early. And all focused for us around the goal of really preparing each and every one of our young children to succeed as they're entering school. The imperative for us from the science here of reaching our children early and providing them what they need is stronger than ever. So it's really focused us to do more and push ourselves more around this, really preventative-based policy.
Thank you so much.